Extraoral and intraoral exams. We'll begin with the extraoral. The operator should wear goggles, face mask, cap, gown, and gloves. Patient should be sitting upright for the extraoral examination. First step into the extraoral exam would be for the operator to visually kind of like look around the face to make sure that there's no abnormalities, to check for any moles or anything like that. Next, you will use the bilateral bimanual palpating. You'll be checking the TMJ. You'll ask your patient to open and close. And what you're looking for is for any popping, clicking, grinding, and asking your patient if they feel any pain as you palpate and having them open and close. Next, you will be palpating the auricular nodes. We'll do the anterior, inferior, and finally posterior. Next, you will be palpating the mandible borders to palpate and check the submandibular nodes. You'll walk your fingers to the submental to check for the submental nodes. Next, you will check the thyroid. You'll use a bimanual technique. Ask your patient to swallow. By holding the thyroid. The next area to palpate will be the superficial and deep cervical lymph nodes. Next, using the bimanual bilateral palpating technique, you'll have your patient turn to the right and have them tilt their head down while you locate the superficial lymph nodes, cervical lymph nodes. Simultaneously locate the deep lymph nodes on the right side. Do the same thing for the other side, superficial and the deep lymph nodes. Next, you will have your patient, you'll be behind your patient, have your patient tilt their head forward, and you'll be palpating the occipital nodes. Start at the base of the neck and continue to move upwards. This concludes the extraoral exam. Once you have finished the extraoral exam, go ahead and remove your gloves. Hand sanitize your hands and don on a fresh pair of gloves. We will be observing the lips, the vermilion zone, the commissures, the labial mucosa, and the lower mucosa. Then you will be palpating the upper lip, then the lower lip digitally. Next, you will be observing the buccal mucosa. For the right side, you'll ask your patient to turn towards you. For the left side, you'll ask your patient to turn away from you. Let's begin. So you take your mirror and you start observing, making sure that we don't find anything abnormal. Once you have observed, you're gonna go ahead and take your 2 fingers and palpate the buccal mucosa. Make sure that you keep in mind which finger you use for the inside. Once more, we don't want to use the wet finger and touch the patient's face. You'll want to go ahead and take a cotton tip applicator, and you will be expressing the parotid papilla. Next, you will go ahead and observe your patient's hard palate. For this, you'll have your patient tilt their head back. Using your mirror, you will be observing the incisive papilla, palatine raphe, and palatal rugae. After you have observed the hard palate, you're going to go ahead digitally palpate. This may tickle, so you make sure you want to let your patients know what you are about to do. Next, you will be observing the oral pharynx. To do so, have your patient say ah. By doing this, you will be able to view the anterior and posterior pillars, the tonsils, the uvula, and the posterior wall of the oral pharynx. You take your mirror. Ah, ah. Next, you will be observing the tongue, dorsal, both lateral borders, and the ventral. Let's start by observing the dorsal surface. Then you'll go ahead and take a gauze so that way you can retract the tongue both ways to observe the lateral borders of the tongue. Then you will be observing the ventral. You'll have your patient bring your tongue up. Following the observation, you will digitally palpate the tongue. Next, we will be observing the floor of the mouth. Have your patient bring their tongue to the roof of their mouth, and you'll be able to observe the floor. You'll be looking at the lingual frenum and the sublingual caruncles. With your left finger, go ahead and palpate the floor, and the right hand will be down at the chin, pressing upwards. Next, we will be observing the alveolar ridges. To do so, you'll have your patient bite down, hold their lips and bring them up so that way you are able to view it. Same with the bottom, bring them down so that way you have a good view. You'll also will be viewing the lingual alveolar ridges with the mirror. Palpate digitally. This concludes the intraoral exam. Always make sure to communicate the following steps that you will be taking with your patient. That way they are aware and feel more comfortable with you. Also, make sure to always record all of your findings.